checking in from LIVESTRONG headquarters. I'm here with Brandon Hayes-Latin, cancer survivor, medical oncologist, and co-chair of the LIVESTRONG Young Adult Alliance. So many of you sent in questions for Brandon on Twitter, so we thought rather than post the answers, we'd get a video with some answers. So thanks for being here.
You bet.
Tell us what the Young Adult Alliance is.
So the Young Adult Alliance is a program in the Lance Armstrong Foundation that serves young adults between the ages of 15 and 40 who are diagnosed with cancer, because it is actually the leading natural cause of death in that age range. And it's a coalition of organizations that serve young adults. There's about 110 member organizations right now.
Awesome. Well, as you know, both of us diagnosed as young adults, so it's a passion of ours. One of the questions that came in was around standards. When are they going to have standards for young adults in terms of their treatment and cancer care?
Yeah, so the Young Adult Alliance is actively working on that right now. We actually organize our work in different task forces, and there's a whole task force that is labeled the Standards Task Force. They've already produced and will publish this year standards for an educational curriculum for healthcare providers, so doctors, nurses, therapists who deal with young adult cancers. What do they need to know that's specific to young adults? In 2 weeks, the Standards Task Force is going to host a meeting to look at cancer centers. What are the core components that a cancer center should have to be a quality AYA program? That includes things like an overlap between pediatric and adult oncology, access to fertility preservation services, access to social and support services that are age-specific for young adults. So we're working on it.
Awesome. For those of you that are in Portland, check Brandon out at Oregon Health Sciences University or on Twitter at Hayes-Lat. And last question, Brandon's a big skier, and somebody asked, how do you get young people to talk or think about prevention and awareness around cancer?
Yeah, I mean, it's really never too early to start thinking about healthy diet and exercise. We know that there are a lot of long-term cancer risks to health behaviors. We're just learning about what that means for young adult cancer. So oftentimes a young adult is diagnosed before those sort of environmental things catch up to you. But for instance, smoking, the most prevalent age of smoking is young adults. And what happens in young adults is going to play out the rest of their lives. So really important.
And lastly, just one more question, because this came in a few times, which was around clinical trials. Why don't young adults participate in clinical trials?
We think a lot of that is awareness, both on the young adult part, but also on the provider part. Another one of the task forces of the Alliance is an awareness task force, where we're trying to get the message out that cancer happens in young adults, but it happens sporadically. So when it does occur, we need to think about clinical trials right away.
Awesome. Well, Brandon Hayes-Latin, doctor, survivor, leader, and co-chair of the LIVESTRONG Young Adult Alliance. Glad to have him here in the office, and we'll check in soon.